Well, good afternoon, and thank you all so much for being here. And you know, this afternoon we are updating you on Hurricane Delta. I'm joined by leadership, our Director of Homeland Security, Mr. Colin Arnold, even our Colonel Terry Everett, who is Director of Homeland Security and Public Safety for the City of New Orleans. I also have joining us Bob Turner with the Sewage and Water Board, our Superintendent of Police, Sean Ferguson, our Superintendent of the Fire Department, Tim McConnell, also joined by Dr. Emily Nichols of EMS. And is Tyrell here? I didn't see Tyrell. Okay. All right, so we're here, all lined up, ready to roll. Bottom line is the City of New Orleans continues to be prepared for hurricane season. Although Hurricane Delta is moving very fast. And although we have noticed the rate and the pace of storms coming our way, of course, with this season, we will be doubling down on our efforts to modify our evacuation plans because these storms, again, are moving faster and they are currently not aligned with our plans in place in terms of our 60. And of course, when we talk about a citywide evacuation plan and the like. However, right now, we're told that Delta has the ability to strengthen to Category 4. Delta will bring to the area the intensity of the storm is very unpredictable right now. Even the 4 o'clock kind of shifted to the west, but again, putting that focus still on the City of New Orleans and our lower lining areas outside of the levee protection system. On tomorrow, we'll get in this rhythm. We'll give you an update on tomorrow. But today, we're wanting folks to get ready and get prepared. The impact is expected as early as Friday morning. Most likely the time will be Friday afternoon. But again, we're monitoring and we will keep you up to date. Significant rainfall. You know, this is something we always are focused on, but also damaging winds is what we're told Delta could bring to us. Life-threatening storm is what we are being told. So again, we're taking this very seriously. We're deploying all of our assets effectively, and you will hear more from my team following me. There's a wide range of ways the storm can affect us. That's when I talk about that unpredictability about Delta here. But again, we will be prepared for all of the outcomes. Of course, we are still providing service to our evacuees who are here in the City of New Orleans. Right now, we're a little over, I want to say 6,900. Colin can get me straight on that. You know, we have been in a rhythm of our evacuees returning home, and so we've gone from 12,000 to right around 6,900. Again, he'll get me straight. We have definitely been in constant contact with all of our partners, stakeholders, and the like. I just finished with a briefing, and again, I am just so thankful that I have the team that we have for the City of New Orleans. We've demonstrated over and over again that not only we're prepared, but we are a team and we work accordingly. We need our people to text Delta to 888-777 to receive updates in a timely manner. This is very important. We have over 100,000 of our people who are registered right now. If you're already signed up, you're already signed up. No need to take any further steps to get the information that you need to protect yourself and, of course, families and neighbors. I'm going to now turn it over to Colin Arnold, who will move us through our press conference, followed by, again, leaders that I mentioned, and we will go to Q&A and proceed accordingly. So thank you again. And Colin, I don't know if you were to my right or to my left.
Right here.
Bam! All right.
Right. Good evening, everyone. The New Orleans Office of Homeland Security and Emergency Preparedness is closely monitoring Hurricane Delta alongside our public safety and infrastructure partners at the local, state, and federal level. Our Emergency Operations Center remains partially activated due to COVID and a lot of the other things that have been occurring over the last year. but we will transition into a hurricane activation later in the week based on the track of the storm. At this point, the main threats from Delta and the New Orleans area are forecast to be tropical storm force winds that could cause downed trees, prolonged power outages, heavy rain that could cause street flooding, and dangerous storm surge outside of the levee system. For these reasons, we are making the following announcements. We're awaiting better storm surge modeling from the National Weather Service for the areas outside levee protection. The storm Delta is still, obviously in the Caribbean. It has to interact with the Yucatan Peninsula overnight tonight and tomorrow. We anticipate better storm surge numbers tomorrow morning from the Weather Service, but it stands to reason that we will have to address the areas outside levee protection, being Venetian Isles, Irish Bayou, and Lake Catherine predominantly. And we will get that message out as soon as we have some better numbers. The New Orleans Health Department is working directly with residents who depend on power for medical devices to ensure their safety. If you have a medical or mobility need, sign up at our special needs registry at specialneeds.nola.gov or just by calling 311. Parking on neutral grounds and sidewalks will be allowed beginning at 6 p.m. Wednesday evening. We do anticipate some rain starting on Thursday and the winds more on Friday. In partnership with the New Orleans City Council, the city will be distributing sandbags at 5 locations starting tomorrow at 8 a.m. while supplies last. These locations are the Arthur Munday Center on the West Bank on Newton, the Dryades YMCA on O.C. Haley, Milne Recreation Center at Fillmore and Franklin, St. Maria Goretti Church on Crowder Boulevard, and at the Mid-City Library on Canal Street at Carrollton. I want to be clear that we are keeping a very close eye on this storm's intensity because it's very unpredictable right now and it's got a ways to go. Forecast models continue to show Delta weakening to a Category 2 before landfall, but the rain, the winds, and the storm surge associated with these models, they indicate that while there are significant potential issues that we will address, they are manageable in a shelter-in-place scenario at this point. But we're watching this very closely, and if the intensity changes or anything changes that we need you to know about and impacts increase, we may have to reevaluate and we'll let you know. First thing, I'm asking that, again, this is the 6th time this hurricane season that I've stood here and asked people to be ready. We've had 5 near misses. We need to watch this one very, very, very closely. We've been through a lot the last 12 months in the city, but what it has revealed is that over and over again we're resilient. As a community, we take care of each other. So gather your emergency supplies, pay attention, heed warnings, and please check on neighbors and loved ones, please. Text Delta to 888-777 as the mayor mentioned. Follow us at NOLA Ready or at ready.nola.gov, and we will get through this like we always do, together.
Thank you so much, Al. And you want to?
I will. I'll Bob Turner, General Superintendent of Schools.
All right, so good afternoon, everybody. Sewage and Water Board has been preparing for this storm as of yesterday evening late. This morning we had our first formal preparedness meeting. We'll be conducting those every morning at 7:30 a.m. From now until the storm passes. Our staff is ready. We have enough people to man all of our facilities as required, and all those essential personnel. And we will be putting together the rosters that are going to be required to make sure that we man all those facilities properly. At the present time, we have 98 out of 99 drainage pumps available for use. I know yesterday, I think you saw 99. That was actually an error on my part. We had 98 because we had one pump A at Station 7 that is out of service. However, as of yesterday, we've been working double shifts on that pump. We expected to have it back in service before Friday morning. Perhaps a little bit earlier than that. We'll see how that works out. Also, you may have seen that turbine generator number 3 was listed as out of service as late as this morning. Today we buttoned that piece of equipment up and we have tested it. So now we're calling it back in service for emergency use only. That turbine has been an emergency use turbine for better than a year and a half now, because of the condition that the machinery is in. We have one small pump out at one of the underpass stations. That's Press Street. There are 3 pumps at that station. 1 out of 3 is out. We don't anticipate any major problems with that. In terms of power, turbines 1, 4, and 6 are available, as well as all 5 of the EMDs. And as I said, turbine 3 is now back in service for emergency use. We may see some significant rain with this event. That's what we're looking at, possibly 4 to 8 inches at the present time. If it occurs over the course of a couple of days, we should be in pretty good shape. If we get, of course, anytime we get 4 to 6 inches or 8 inches of rain in a couple of hours, we're likely to see street flood. Additionally, one thing that's new with this storm compared to the other 5 that Colin said were near misses, we spent a little bit of time and some funds this year to install a new feeder that goes from turbine 6 at the Calvin Water Plant to the Calvin Frequency Changer Facility. So we are now able to back up the energy power that feeds that facility with turbine generator 6. So we're able to utilize turbine 6 to a greater capacity than we have been able to in years past. As I said before, Surgeon Water Board employees are ready for this. We've had 5 practice sessions, if you will, just this year for these storms, and they're ready to go to take care of anything that might come our way. We also encourage you to follow us on Facebook, Instagram, and Twitter for updates throughout the event. That's at SWB New Orleans. And again, it's on Facebook, Instagram, and Twitter. And typically what we try to do is we will try to give updates in as near real time as possible as far as the condition of our equipment, any significant issues that we are aware of out in the system, and those types of things. So with that, I'm finished. And next is Superintendent Sean Ferguson.
Thank you so much, Attorney.
Good afternoon, everyone. New Orleans Police Department remains ready and prepared as usual for any possible impacts from Hurricane Delta. Our officers are prepared for 12-hour shifts with all hands on deck if necessary, when necessary also. We've shifted, adjusted some of our deployment thus far this week in preparation for this weekend's expectations from the storm. We have not been and will not be impacted operationally as a result of any COVID, officers being out because of COVID. We have approximately 5 officers that are out now, but that does not impact us operationally whatsoever. We are securing our assets that are not needed for a hurricane response. However, our boats, high water vehicles remain on standby at all of our district stations for potential search and rescue missions. Our generators have been tested and are prepared. We have strategically pre-staged barricades throughout the city with expectation of any possible flooding that we may see. We are prepared to implement Operation Underpass if necessary. We continue to urge and encourage you, community, to make your safety a priority by adhering to the guidance of all of our public officials during this anticipated emergency. Make sure you have enough food, medication, water for at least 72 hours. And please do not forget to check on your neighbors, especially the elderly family members, as well as your neighbors themselves. Be cautious. Do not engage in any activity that put yourself or your family at risk. The less you put yourself at risk, the less we will put our public safety team at risk. Meaning, please do not drive through standing water, do not walk or stand in standing water. As always, do not take this situation lightly. Now is the time to get prepared as we are preparing ourselves as a city for this hurricane. Again, we stand ready and prepared to assist wherever and whenever possible. Please be safe. Thank you.
Thank you, Chief.
Next, we'll have Chief McConnell, Fire Department.
Chief.
One OFD plans to be fully staffed if the storm impacts the city of New Orleans. All of our stations are in the process of finalizing preparations for a storm entering the Gulf according to our hurricane plans. We have all our high water vehicles are still in place, and our water assets, boats, are in place from our earlier storms that we have been preparing for this year, making sure that everything's fueled up. Your public safety team, and indeed all the people who respond on your behalf for the city, we're prepared for this. We do it regularly, and as you heard everyone else say, that's number 6 this year. But never take anything too lightly. I can only re-emphasize what the chief said. You never know what the impacts of these storms are going to be. We've seen them over the years, and there's a reason that the National Weather Service, when they say the impacts can be felt well outside of what the cone is. So although right now we seem to be near the edge of it, we are still in that cone, and things can shift very, very quickly. So I'd ask everyone to please don't take it lightly, heed the warnings, make sure you're prepared for this, and we'll hopefully get through this as we have many others. Thank you.
Thank you, Chief. Dr. Nichols?
Good afternoon. As we monitor Hurricane Delta, New Orleans Emergency Medical Services stands prepared to support the residents and visitors of our city. We are currently assisting the Departments of Health and Homeland Security to ensure that the persons with the greatest medical needs are supported during this time. We are mobilizing our high water assets so that we may respond to medical calls in floodwater if necessary. Our standard 911 response to calls will continue as long as the weather safely permits our EMTs and paramedics to do so. Preparation is key. Refill any prescriptions now. Address any immediate medical needs now. COVID-19 is still among us. We've come too far to let our guard down. Continue safe practices with hand washing, face covering, and social distancing whenever able. Our EMTs and paramedics are available for life-threatening emergencies. We will continue to work with our public safety partners to respond to emergent needs.
Thank you so much, Dr. Nichols. And Colonel?
Thank you very much, Madam Mayor. I just want to reiterate what you've heard from every one of these department heads. We have 3 missions, and you've heard me say this again, and this is our mission, is to protect the lives of our citizens and our visitors, stabilize the infrastructure and protect it, and provide security for each and every citizen. But to do these 3 things, we need your cooperation, and to do the things that these department heads have worked so hard with their staffs to create. So we'll get through this, we'll adapt and overcome and meet the needs of this challenge. But again, we've got those 3 missions, and that's what we're here for, but we need your cooperation. Thank you very much.
Thank you, Colonel. Always need a good colonel.
Right, so you've heard from us, and Ms. Latanya, I think it's a great segue for questions.
Mayor, you mentioned evacuations. How are those being assessed? Should there be a need to call for that?
Well, first of all, it's getting updates to how the storm is tracking. And once tomorrow morning, we will be waiting and looking and aggressively having to make decisions relative to any evacuations. What we know right now is focusing on our lower lying areas outside of the levee protection system. But when you talk about, other areas, in the city particularly, it's going to be looking at the data and making a hard decision that is not just in isolation of my neighboring parishes. So this is a unified effort, especially when you're talking about an evacuation with the timing of Delta. It even prevented us from moving forward with our CEA agreement, you know, in terms of when you're talking about city assisted evacuation, citywide assisted evacuation. So that's what I kind of touched on when I started this press conference about the timing and how fast, you know, these storms are coming. And Delta is an example of that. I'll ask Colin to just give you a little bit more meat on that, if you don't mind. Colin?
Kind of said earlier that right now this supports a shelter-in-place scenario. You know, you're looking at potentially 4 to 8 inches of rain, maybe some more over about a 4-day period. You're looking storm surge, like I said, we're still going to look at, but that's really in the areas outside the hurricane and storm damage risk reduction system, the levee system. And then you're looking at winds, and you know, hour by hour through Friday, looking at right now 40, 50 mile an hour winds potentially for about a 10-hour period. And you know, when the Weather Service, which is who we use, says, you know, category 2 on landfall, you know, that falls below our threshold that we would do for a major hurricane. And that's where we're at right now. But can that change? That absolutely can change, and we'll have to evaluate that constantly. And when I say we're looking at this, it's not hour by hour, it's minute by minute. You know, we're looking at this constantly. Phone calls, conference calls, emails, and just every product that we can get from the Weather Service we address and look at.
WDSU followed by WWNO.
And I mean, just when it comes to the evacuees that are here right now, is there a game plan in place for them should we have to evacuate?
Oh, absolutely.
So, I guess a fortunate thing about many of these evacuees came in private vehicles. So, for the most part, the evacuees that came here pre-storm by bus have gone back to the affected area, to Southwest Louisiana. So what we would look at is if something did have to happen, many of them are POV, they're in their own vehicles. So that's a positive in this that we'll address. We've also worked with the state and the Red Cross to identify those that maybe do have some mobility issues. They're in about 4 hotels right now and we're tracking them. So we'll work with the state in case we have to spend a little bit of extra time with them.
WWNO.
Yeah, so, what's the sort of like last minute you could call an evacuation if you needed to? In terms of the time frame, is it 60 hours? I can't remember
Tomorrow
the
morning,
threshold.
well, normally we would begin at hour 60.
That wasn't an option at all. And so as I have been informed that we would have to be looking at somewhere tomorrow morning, but right now it doesn't call for that. But this could easily change. And so we're behind the 8 ball. Okay.
I would just add that to reiterate, right now, we are not seeing the impacts that would indicate an evacuation scenario. If we did, we have to remember it's not just New Orleans, it's our entire region, the metro area. So we're talking about 1.2 million people. You're talking about 40 hours clearance time is what it's called. So that decision would have to be made at a minimum then. And I would remind people that, you know, this would bring into other things like contraflow and things like that we're not, again, this storm at this point does not indicate that, but we're certainly, you know, if those ideas, those things have to be reevaluated, it's a conversation that will be had with the state and all of our regional partners.
New Orleans Advocate.
Given the speed and the strength of these storms, what are some of your recommendations to the state if we do change the overall hour 60 plan? Should we be looking at hour 80 or, you know,
Well,
even earlier?
Right, well, and that would be really in coordination with our state partners, all partners in this unified command as we look at evacuations or just responding to these threats. It has to be done in a holistic manner. So it will not be just Orleans. However, we definitely would give input based upon the number of people that we have to move to safety. And of course, any existing conditions that are unique, for example, right now with evacuees being amongst us. And of course, our visitors, you know, given COVID, we're not at 19 million, you know, this year. But again, when you're thinking about plans in place, you have to account for that as well. Anything to add, Connie?
Clock State. WDSU.
This is off topic, but is
Well,
the
I'm
Thanksgiving?
gonna get, wait a minute.
off topic, let's wait.
Yeah, wait, I'll clean it up later on, let me get, I don't wanna subject all the folks though.
You know?
This is the sixth time that Louisiana has been facing uncertainty in that cone. Why is it important for residents to treat this system with the same amount of, I guess, urgency as the ones in the past?
Well, simply because each storm is different, and the impacts could be different as well, and we have to take them serious every single time. The threat to life, hey, I don't think it gets any serious than that, just as we responded to this pandemic, looking and focusing on the health of our people, but life of our people. So I would just reiterate to the public that, hey, we have to understand where we live. We have to understand that. We are a coastal community as well. And we also have to embrace what we know, the science that speaks to climate change and how this city has taken measures in place to address it and to protect our city from it for generations to come. But it is centered around how we respond as a community and as the people. Yeah, go ahead. Sorry.
No, I just wanted to say, this community's been dealing with stuff since last October. Hard rock, cyber attack, COVID. The list, and the 5 other events, tropical events we've had this year. So I was on the Weather Channel this morning, and he said, surely the people just must be so tired. And it's like, I fundamentally disagree with that, because every time we've asked the public to do something here, they've listened. And I would say that the country is watching right now, so let's do what we have to do to get through this.
Thank you, Colin. I'm kind of putting together my 12 days of Christmas. What I don't want for Christmas.
The lens?
Yeah, and I'm sorry if I missed this, do we have an estimation of how many Hurricane Laura evacuees are still in the city?
61.
6,100. I initially said 69. It's 6,100, and that's down from the 12,000 that we've been servicing.
WGNO.
I missed it. Can we confirm what time sandbags will be given out and what date again?
Okay, Colin, I know tomorrow, but you want to give the locations, and I'm working actually to add one in the lower 9 by desire, because Miss Marguerite Johnson emailed me right before coming in here, and I sent it to Keith, my director of DPW, and so we may alter it a bit, but he'll give you what we have.
Awesome.
So it's tomorrow, starting at 8 a.m. at all the sites while supplies last, which in our previous experience, as much sand as we can put out there is usually gone in about 4 hours, so bear that in mind. On the West Bank, on Newton, Arthur Munday Center. In Central City, on O.C. Haley, Dryas YMCA. In Gentilly at the Milne Recreation Center, Fillmore, and Franklin. Out in the East, St. Maria Goretti Church on Crowder. And at the Mid-City Library in Mid-City. At Canal and Carrollton, and potentially in Lower.
We're working on that. Anything else?
Is the Saints game still on Monday? That was the question.
Well, I think the Saints do play on Monday.
Okay, so it's still on.
As far as I understand, and it would be, I believe the NFL and the league, they would have something to say, in regards to that. But as I know right now, the game Monday Night Football is still going to happen.
And are you worried about power outages and strain on first responders handling game day activities?
Oh, I'm worried about the strain on my first responders. I have been significantly, but as it relates to that particular game and with minimal participation like fans and the like, it should be manageable, but we'll work through any issues and conditions that we foresee with the Saints organization.
Now, we have no other questions.
Okay, thank you all so much.